and the ear infection, otitis media. These are the presenting complaints, or the chief complaint, or the primary complaints. Physical findings, these are all the physical findings. Now, what will be your diagnosis? And what is most likely diagnosis in this case scenario? Keeping in your mind the central and the peripheral lymphoid organs. Yes, write down in your chat box what will be your diagnosis if a patient came to your OPD with these complaints. Yes, please. What will be your diagnosis? Adenoids. Adenoids, okay. Ulam, tonsillitis, okay. Nasal mucosa is present over there. These are the clues to identify the lymphoid organs. Nasal mucosa, nasal passage is blocked. Something related to tonsils. And palatine, सारे lymphoid organs बता दिए. Pharyngeal tonsil, okay. Acute type maybe, yes. It is an acute episode. Okay. Let's see what is the finding. So, child, mostly affected 5-year-old child, respiratory clinic with persistent cough and the discomfort during sleep, nasal obstruction. So the nasal passage is blocked, and plus that passage, the location of the type of tonsil that is present over there. Yes, pharyngeal or the adenoids or the tonsil. Somebody written over there in the chat box, tonsillitis. Tubal tonsil. So the exact location for the, because it blocks the nasal passage, is the adenoids, and it is located in the nasopharynx, blocking the whole nasopharynx. That's why patient is uncomfortable to sleep, to take proper sleep during night. So this is purely the case scenario related to the adenoids, inflammation or infection of the adenoid. This is the slide showing the location of the, this is the inflamed tonsil adenoids that is present. The palatine tonsil, we have the tubal tonsil, this Valdier ring which we discussed in detail. Nasopharynx, it blocks the nasal passage. That's why patient feel difficulty during sleep, and in the morning time persistent cough occurs. Obviously, definitely, parents have to seek for medical advice due to this, condition of the patient. Inflamed adenoids, inflammation of the adenoids. Due to location, you can identify. Somebody written in chat box the lingual tonsil or the palatine tonsil. It is purely the adenoid that is located in the nasopharynx, case related to the adenoid. Adenoid hypertrophy, and it can lead to the inflammation or repeated inflammation or recurrent inflammation of the ear also, because it blocks that passage related to the eustachian tube, and the complications related to the adenoid hypertrophy. One of the complications is the otitis media, adenoid inflammation. Actually, what happens, the size of the adenoid increases with age, and it reaches its maximum size at the age of 8 to 9. Later on, its size decline, volume of the adenoid decline. Children's range of movement or motion increases with age, but at that 5 to 6 year of age, the immune system yet not properly developed, and the function of these lymphoid organs, adenoid is the primary peripheral lymphoid organ, is to boost the immune response by the antigen antibody by mediating the antigen antibody response. Now, enlist. So this is a case purely related to the adenoids and how we pick that this is a case for the adenoids according to the location of the tonsil and the primary chief complaint related to that. Enlist all plus the age of the patient. Age of the patient is also specific. Enlist all the symptoms that can be presented in this condition. और क्या-क्या symptoms हो सकते हैं that comes in your mind? एक तो nasal passage block हो गया, patient feels uncomfortable to sleep, to take proper sleep, और otitis media भी हो रहा है. Any other symptoms that comes in your mind for this case scenario? Yes, please. Any other symptoms related to this case scenario? Maybe pain, breathing problem, yes. Chest tightness, very good. It can happen. Okay. So the symptoms related to this snoring, open mouth breathing, it can happen in adults as well. Chest tightness, which Mustafa wrote, that is the breathing problem. Recurrent upper airways infection is the most common complaint in children's. Repeated episodes of recurrent upper, acute episodes, acute chronic, more than 2 weeks. For acute, we labeled 1 week with the fever, sleep apnea, patient feel uncomfortable to sleep, and white foamy discharge or yellow-green discharge or the sputum. That is also the complaints or the symptoms associated with this condition. These are the symptoms of the adenoids, nasal discharge, and it can even block the tube also, eustachian tube also. Primary infections, secondary symptoms, it can present with the secondary symptoms also. Only the otitis media can occur, not necessarily that the patient present only with the cough, sleep disturbance, and the nasal blockage. Secondary symptoms can occur. How can you manage this patient? What comes in your mind? If that patient, what comes in your mind? Snoring. Yes, the main problem is due to snoring is adenoid, but keep this in your mind. The snoring can be due to pharyngeal tonsil also, blocking the airways passages. For this, we do the endoscopic assisted technique to further visualize the different types of tonsils and the location of the tonsils. Anti-inflammatory medicine, good. Anything else? First, what we will do, what investigations first we will make, then we will go for the treatment plan. Na? Management कैसे करेंगे? What main investigations? What are the main investigations we can do? And then we will go for the treatment plan. Yes, please. relax the obstruction in air path, very good, by antihistamine, antibiotics, anti-inflammatory and saline irrigation. पहले ये करके देखेंगे. But before doing this, we will go for the focused proper history. Okay. Focused proper history, complete detailed history must needed. General physical examination, some clues we can get by the help of general physical examination. Adenoid assessment with radiography or direct visualization. And this direct visualization or by the this volume of the adenoid, it gives clues for the inflammation, and the radiographic assisted visualization. Lateral neck radiography. Radiography is the best technique. X-ray examination. The first one, X-ray examination, we will go for the patient X-ray examination. Lung function test. We will do the lung function test as well to exclude any lung disorders, lungs pathology. Posterior pharyngeal wall mucosa simply by depressing the tongue and checking the mucosa. Paranasal sinus CT scan we can do. This antihistamine, saline irrigation and antibiotics. Fiber optic nasopharyngoscopy. Now, what is this fiber optic nasopharyngoscopy? Is endoscopy assisted, and we will do this by endoscope by keeping a tube inside the nose of the patient, and we will observe the different airways, nasopharynx, laryngopharynx, by using this fiber optic nasopharyngoscopy. It is for the dynamic visualization of the adenoids, and by doing this we can localize, we are able to identify where is the inflammation or proper infection is present. Fiber optic naso, if this is not treated by these antihistamine se bhi sahi nahi ho raha, saline irrigation, antibiotic, then we will go for this fiber optic. First is the X-ray examination, lung function test to exclude, because the breathing disorder is associated with the lung function test, and the paranasal sinus CT scan, then we will go for this. This is the fiber optic nasopharyngoscopy of a child. We will keep the monitor is present over there. A tube should be inserted into the nose of the patient, and then it is endoscopic assisted technique, and then we can visualize the adenoids on the screen by using the transnasal approach, and we can remove also the adenoid by the nose through the transnasal approach or through the mouth orally. This is called endoscopic assisted technique for the removal of the adenoid also. This is fiber optic nasopharyngoscopy, and the screen monitor is present over there to identify how much inflammation is present over there, what is the size, volume of the adenoids. Now, adenoidectomy. Adenoidectomy, in my previous lectures, most of the students asked regarding this surgical procedure, what will be the indication for this surgical procedure when we will do this removal of the adenoids. Severe cases adenoid tonsil. Okay, so adenoidectomy alone is safe and the reasonable treatment approach for the pediatric population as compared to the tonsillectomy and adenotonsillectomy. Mortality rates and morbidity rates are higher if the tonsils are also involved or along with the adenoids. First, we will do the only removal we should do for the adenoids, and it is safe procedure for the pediatric population. Bleeding is less, pain is less in that patients, and that is also endoscopic assisted surgical procedure we can do by using the transoral passage for the removal or the transnasal route for the removal of the adenoids. Now, if the etiology is unclear, that is not crystal clear, what will be the cause? Recurrent persistent cough है, patient या adult age में आया हुआ है, कोई snoring भी है उसको, ठीक है, bad breath भी है physical examination में, और ट्यूबर कुछ presentation ऐसी है कि localize, you are unable to localize the location of the tonsil with which one tonsil is involved. Then we will go for another technique that is called DISE, drug induced sleep endoscopy. That is also endoscopic assisted technique for the evaluation of the nasopharynx, all the airways during the sleep. During the sleep, we will do for this, and that is very common practice. If the etiology is unclear, it will give proper clues, proper passage for the clear passage for the nasopharynx, larynx complete इसमें identify हो जाएगा क्या situation है, what will happen in the larynx, nasopharynx or the oropharynx. Drug induced sleep endoscopy. Now, what are the indications for adenoidectomy? Most common indications या फिर क्या indications हैं? First, we will go for the conservative management, जो कि हमने कर ली. We use the antihistamine, saline irrigation to open the nasal passage, the antibiotics. After doing this, fiber optic nasopharyngoscopy, X-ray technique starting में होती है most common investigation. Then we will go for fiber optic nasopharyngoscopy to identify and the indications for adenoidectomy. What comes in your mind? What will be the indications for the adenoidectomy? Yes, this is the right one. We have to remove the adenoids. Presenting complaint, we discussed in detail the primary presenting complaint and the secondary presenting complaint. Then what comes in your mind? Yes, please. Indications for removal of the adenoids. Anything that comes in your mind, you feel free to write in your chat box. Yes, please. Recurrent nasal infection. Good. Nasal infection, nasal blockage, ठीक है? Recurrent upper airway infection. This is the proper term. You can write it. Recurrent upper airway infection. Okay. And anything that comes in your mind? Okay. Sleep disordered breathing problem, nasal airway obstruction, recurrent otitis media. This is the proper term. Recurrent upper airway infection or the recurrent otitis media. This bar patient को बार ear infection along with the discharge. This is we use effusion. If there is a discharge also, otitis OME, then we use the term otitis media effusion. Recurrent upper ear infection, rhinosinusitis. That's why to exclude this, in the investigation, we also did the paranasal CT scan, otitis media effusion. This is the most common identification. Upper airway infection. This is the most cough, persistent cough. The patient is unable to sleep. This is the most common indication. Yes, we have to remove the adenoids at that time. An approach we already discussed. The कौन सी approach हो सकती है? Most common indication for adenoidectomy, otitis media effusion, recurrent upper airway infection. Otitis media खाली alone था, discharge नहीं था patient में, but what happened? Frequent episode हो रही है, year में 3 to 4 times child came to the respiratory clinic with a complaint of discharge from the air. Then we will go for the adenoidectomy. Okay, reasons for removing the adenoids, because it can block the eustachian tube as well. Dono ear block ho jayenge, patient is unable to hear also. Obstructive sleep apnea, this complaint is also common, but it is more common in snoring adults. Block ears, recurrent rhinitis, nasal discharge, ear discharge. This is the presenting complaint for adenoids in children. Enlist all the investigations for quick diagnosis. Abhi investigations, we are done with the investigations. X-ray investigation, radiograph is the most common investigation. Then we will plan for the fiber optic, but in later cases. First X-ray, we will go for the X-ray and the lung function test. X-ray, lung function test to exclude lung disease, and at the last we will go for the fiber optic nasopharyngoscopy. What happened if untreated? Now this more white mucus production is. If what happened if untreated, agar without treatment we left it for months, what will be the complications of adenoid hypertrophy? Otitis media भी है, patient को sleep discomfort भी है, upper respiratory tract infection भी है. What will happen? What will be the complication? Yes, write down in your chat box. Difference between the tonsillectomy in this case. Okay, we will discuss. Very good. Hearing problem and the breathing problem. Yes. Later on, what happened? Adenoids, itne bade swollen मिलेंगे. Patient can develop the breathing problem as well. So the complications: otitis media due to adenoid hypertrophy untreated, discharge or mucus, watery mucus or pussy discharge can occur along with the wax. So it will be converted into the otitis media effusion, and later on hearing loss can occur. Speech loss can also occur. Hearing and the speech loss. These are the complications if we left that patient untreated. Name the components of the Bellier's ring. Yes, due to decreased immunity, Bellier's ring. Name the complications of the Bellier's ring. What are the components of the Bellier ring? क्या थे? Pharyngeal tonsil is purely in the pharynx. Okay, pharyngeal tonsil. Then lingual tonsil. We discussed the location of the lingual tonsil. 2/3 of the 2/3 and 1/3 of the tongue is divided by the sulcus terminalis, and the lingual tonsil occupies the 1/3. Tubal, pharyngeal, lingual, and the palatine tonsil. Palatine tonsil we discussed the location of the palatine tonsil as well. Between the anterior pillar and the posterior pillar, there is a fossa present that lodges the palatine tonsils. Okay, so the components of the Bellier rings: nasopharyngeal, tubal, palatine, and the lingual tonsils. These are the components of the Bellier ring. Now, epithelial lining of adenoids. We discuss in detail the epithelial lining of the adenoids. Write down in your chat box. Yes, please. The epithelial lining. Pseudostratified columnar ciliated epithelium. Yes. Stratified squamous non-keratinized we discussed purely for the palatine tonsils. Palatine tonsils that is present in the tonsillar fossa or Smith traps हमने discuss किया था in vaginatal the pseudostratified columnar. That type of tonsils adenoids receives the epithelial lining of the nasal region, nasal passage, the respiratory passage, pseudostratified columnar ciliated epithelium. Very good, Javeria. Good. Stratified squamous non-keratinized is for the purely for the we discuss in detail for the palatine tonsil. The only single tonsil we discuss in detail the histological features, preps, and the hemicapsule we discussed in detail in our previous lecture. So this is the pseudostratified columnar ciliated epithelium, the epithelial lining. Now list the complications that may persist as a result of delayed management. Complications of the adenoid hypertrophy. We already discussed the complications of the adenoid hypertrophy. This is the adenoid swellings, adenoid present in the nasopharynx, and it can block the whole eustachian tube, the eardrum can be blocked, and if it happens, patient, it can develop such type of hearing loss can also occur if it in large volume becomes much greater. For this, we have to visualize the adenoids properly by the help of nasopharyngoscope. Now, the volume of the adenoid, assessment for proper volume of the adenoid. Two-thirds of the, if it is more than, there are different degrees for the assessment of the volume of the adenoids. If it is more than two-thirds of its normal volume, then it is labeled as first degree, second degree, or third degree. This is one of the hearing loss is one of the most important complication related to the adenoid, and it can block the whole eustachian tube, and patient is unable to hear. That is the most important complication of the adenoid. We discussed in detail the complications of the adenoid, the chief symptoms associated with the adenoid's primary symptoms plus the secondary symptoms. For proper differentiation between the types of the tonsils, which type of tonsils is involved, first the case focus on the proper case history, detailed case history, then the correlate with the age of the patients and symptoms. Palatine tonsils, tonsillectomy, different tonsillectomies for palatine tonsils. The tonsils, if we remove these tonsils, that the term uses tonsillectomy, and for the proper removal of the adenoids, we use the term adenoidectomy. In some situations, tonsils are also enlarged, plus the adenoids are also enlarged, and that what we use the term दोनों को merge करके adenoid tonsillectomy, that is having higher morbidity and mortality rate, bleeding इसमें ज़्यादा होती है, वहाँ से भी oral approach भी कर सकते हैं, nasal भी दोनों sets remove होते, that is that will cause more morbidity and mortality rate as compared to simple removal of the adenoids. that procedure is called adenoidectomy. So correlate your things with the clinical scenarios as well. According to the location, you can easily identify the most common indication for the removal of the adenoids: otitis media, effusion, OME is the most common, plus recurrent uh, upper airway infections, which can cause the nasal blockage. Cough can also occur. These are the common problems which can happen if the adenoids are involved. Then we discuss in detail the different treatment and the management plan in a stepwise. What we will do in the first, the most common for quick agar decision in a, we will go for the X-ray. Radiographs is the most common tools. The paranasal sinuses, alag lung function test. Then at last, we will help rule out these symptoms by the endoscopic assisted technique also. And if it is still unclear, the etiology, what will be the cause, then we will go for the drug-induced sleep endoscopy to observe the passages, airways during sleep, larynx complete, nasopharynx में complete नजर आएगा, laryngopharynx, and we will identify the inflammation, what extent of inflammation is present in these areas, and what are the different organs that are involved. We discussed in detail the peripheral lymphoid organs and the central lymphoid organs, having different functions. In the previous lectures, we discussed in detail what is the difference between the peripheral and the central lymphoid organs and what they do. Adenoids basically involve to mediate the immunity response, and we already discussed that its size and function reaches its maximum at the age of 8 to 9 years. Later on, its size decreases, and yet what happened in children's immunity gets started developing, and the size of the adenoids decreases, their function also decreases. दूसरे lymph nodes peripheral, बाकी सारे और जगहों के जो lymph nodes हैं, they get involved to perform these functions. Plus the diffuse lymphoid system, lymphoid tissue, which we discussed, that is also present in our body, take part उसको वो सारा जो lymphoid tissue का बाकी function है, that is performed by these diffuse lymphatic tissue. Any confusion, any query related to this topic, this whole content of the histology, best wishes for your meds. Any question, any query related to your topic? Yes, please. Is this clear to all of you? Primary symptoms, secondary symptoms, the investigations, the treatment plan. Any question related to the topic or related to whole blood module? Repeat question number 6. Okay. Yes. What happened if untreated? What will be the complications if it is not treated? दो ट्रीटमेंट प्लान होते हैं, सर्जिकल या कंजर्वेटिव. मेडिसिन देके देख लिया, स्लाइन इरिगेशन भी कर ली, एंटीबायोटिक्स भी दे दी, एंटीहिस्टामिन भी दे दी, पेशेंट रिलीफ फील नहीं कर रहा, देन वी विल गो फॉर दी, पहले तो इन्वेस्टिगेशन होंगी फाइबर ऑप्टिक nasopharyngoscopy, देन वी विल गो फॉर द सर्जिकल प्रोसीजर. और ये दोनों ही नहीं किया, we left that patient untreated, then the otitis media inflammation, simple inflammation of the ear will get converted with the pussy discharge, with the accumulation of the wax, and effusion, thick discharge will accumulate, and we use for this a specific term, otitis media effusion. इतना pussy discharge हो गया, how can patient hear? It can block the whole eustachian tube, the eardrum, and it can lead to the hearing loss. Any question? Any more question? Got my point, Bisma? Any more question related to the topic? Yeah.